Welcome, everyone. We're here with one of our primary care physicians to talk about preventive health, and I'll ask her to introduce herself.
I'm Dr. Kial Wiley. I'm a family practice physician at Fairwood Primary Care.
Let's start with our first question. What is preventive health and why is it important?
Well, preventive health is really the bread and butter of family medicine. It's always our goal to help people achieve the best level of health that we can based on the circumstances. And unfortunately, over the last couple years, things have been a little bit unusual. And so a lot of people have been delaying those visits to their physician when there's nothing particularly wrong and they just need to check in on their health. And now is the time when things are starting to get back to normal that we really want to start seeing people come back to the office, get in for the annual visits where we just talk about your overall health. We talk about any screening that we want to do to make sure that things are going well for you and to just have conversations about how we can work together to help you be the healthiest that you can be.
Why is an annual checkup important?
Well, oftentimes when we see somebody come in because they have knee pain or ear pain or an acute complaint, we don't have a lot of opportunity or time to talk to that person, to get to know them, to find out what their day to day life is like, talk about their family, their hobbies. And we really need to know those things so that we can provide good health care for the whole person, and that is one of the main important things that we get to do during an annual exam. We get to talk to you about your day to day, talk to you about your lifestyle, talk to you about what you think that your health status is, and then help you to come up with ways to protect the good health status that you already have and to help you to maybe adjust some things that you're not as happy with.
What are the most common screenings that people should be aware of?
Well, it varies quite a bit depending on what gender or sex that you are and how old you are. I think the ones that people are most familiar with tend to be cancer screenings. So, mammograms for breast cancer, pap smears for cervical cancer. There are some lung cancer screenings that we do for people who either currently smoke or smoke in the past. Other things that people may not be as aware of are going to be the more routine laboratory work that we do to make sure that your kidneys are functioning well, your liver's working the way it should, that we're not looking at any risk of diabetes or plaque buildup in your arteries from high cholesterol. And all of those things are things that we can work with you and individualize which screening exam is right for you depending on your personal circumstances.
What are other routine labs and lifestyle details that your provider may check?
Well, oftentimes we want to know about what your diet is like, what your activity level is like, how well are you sleeping, what's your stress level, because these are things that really impact your overall health and wellness and can have a pretty major effect on your health even later on down the line. So, we're definitely going to want to ask about those types of things. And again, checking things like how well your liver and kidneys are working, your blood counts, and then tailoring any other labs that we might need to any particular symptoms that you might be experiencing.
What should your provider know about your family history of some health conditions?
More than likely, your provider will have some specific questions, things that they want to know about your family history. Big ones, of course, are going to be any cancer history in your family. There are some types of cancer and cancer syndromes that can be strongly genetic. And so we definitely want to know about any cancer diagnoses. We also are interested to hear about things like diabetes, high cholesterol, high blood pressure, heart attack, stroke. All of those things can have a genetic component. So always better to err on the side of caution and mention something because oftentimes it's pretty important.
Why is it important to share details with your provider about smoking, alcohol, or recreational drugs?
It can be a little bit frightening to do that because I think a lot of people feel like they're going to get in trouble or that somehow somebody's going to find out and it's going to have a negative impact on their life if they talk about those types of things with their doctor. But The truth is that we have no interest in getting you in trouble, and no interest in any judgment for anything that you might currently be doing or previously done in the past. It's important for us even to know if there's a remote history of smoking, drug use, alcohol use, because sometimes, even though those things, those activities are in our past, they can leave marks on our health, put us at higher risk for certain conditions. And really, all your doctor is interested in is making sure you're healthy now and that you keep being healthy. And the only way that we can do that is if we have all of the available information.
If you have concerns about depression, anxiety, or other mental health issues, how can your provider help?
Certainly, this has been a pretty significant problem always, but particularly in the last couple of years as people have felt frightened, isolated, confused, concerned. And more I'm seeing patients come in with these concerns and complaints. And truth be told, sometimes it can be difficult to find the resources to help manage these things, but your primary care provider can be a pretty substantial source of information and treatment for depression and anxiety and other mental health concerns. It can be a good jumping off point if you need additional referrals to psychiatry or a counselor, but sometimes there are things that we can manage in the office on our own when it's a fairly straightforward case. And it's always better to check in, describe what you're feeling, let us kind of ask a couple of questions and figure out what's going to be the best course of treatment to get you back to enjoying life the way you should be.
Thank you for answering our questions, Dr. Wiley. For those of you watching, if you need a primary care provider, please go to the link below to find a physician or advanced practice practitioner at one of our 14 clinics. Thank you.